just mistrust everywhere, and mistrust with the systems, mistrust with their body. So even something like a mindfulness activity, asking them to turn inward and connect with any physical sensation in their body can be extremely difficult and even triggering. And so you want to take it step by step and really just take the time to build that rapport. I think for a lot of my clients, because I'm open about being an individual who also experiences chronic pain, that's something that maybe helps form a little bit of a foundation at the start, because they can look at things that I've done or talked about in the past as being open about that.
Welcome to the Colleague Down the Hall podcast. This episode is sponsored by the Collab Oasis Clinical Consultation Groups. Hi, I'm Jeanene Wolfe, and I'm your colleague down the hall. I have a passion for helping fellow therapists get the clinical and collegial support we all need to do this work. And wow, it just keeps getting harder every day. I'm the founder and facilitator of the Collab Oasis Clinical Consultation Groups. I have been a social worker for almost 30 years, and I own a successful solo online private practice. More of us than ever are practicing in solo or online practices, and we all need colleagues to process cases with, commiserate with on those really hard days, and also to celebrate our successes with. In this podcast, I'll bring you insights about trends and changes in our field and sit down with amazing therapists who are doing amazing work. We'll discuss fictionalized cases, ways to practice sustainably, and of course, there will be plenty of laughing. I love laughing with friends. I'm so glad to have you as one of my colleagues down the hall. Hello, everyone. You are listening to another episode of the Colleague Down the Hall podcast. I'm your host, Jeanene Wolfe, and today I'm joined by Dr. Jamiee Arnoff. Jamiee is a licensed clinical psychologist specializing in adolescents and young adults with internalizing disorders, including those in the deaf community, at her private practice in Beacon, New York. Dr. Arnoff is certified in pain reprocessing therapy and is a valued speaker for discussing mental health treatment for chronic pain. Today, we're going to talk about working with clients with chronic pain and the link between physical and emotional pain. And we'll also touch on some of the effective techniques to retrain the nervous system that Jamie's going to share with us. So welcome, Jamiee. Thank you for joining me today.
Thank you so much for having me.
Absolutely. All right. So let's start by talking through the biopsychosocial nature of chronic pain, if that's a good place for us to get started.
Yes, for sure. I think it's feels very biological in that it is our bodies where we feel the sensations, and that we're worried about tissue damage or structural damage. But that's also just the way that our genetics predispose us to experiencing certain things, how our bodies might, and how we feel through that healing recovery process. But there's such a psychological toll of hurting in any way, emotional pain and physical pain at times sometimes fires off in the same parts of the brain. They're both very real and very valid and very impactful. And then there's a connection of being in pain, physical pain for such a long time, taking a psychological toll on how we feel about our bodies, the distrust about our bodies, how we feel we can interact with other people. And that taps into that social component as well, how we use our support networks when we're struggling, both emotionally and physically, how those people around us can support us through experiences like chronic pain. So it's not just one aspect. I think it's a combination of all three, and recognizing that and tapping into supports through those three categories is very important.
Yeah, absolutely. I have a family member with chronic pain, and so I've seen how it plays out in all those different ways. And there's also so many misconceptions about a lot of chronic pain is invisible, and it's an invisible illness. So what are some of the conceptions that you have seen around chronic pain?
Sure. I think in the absence of structural damage, that can be really hard for both the individual experiencing the pain and providers working to assess, identify, and treat the pain. And that can also be really difficult to communicate to others around you of, I only have this much energy, I only have the capabilities to show up for work in this capacity, or even answer a text and be available to you to chat or simply to listen with a peer or a partner. Not being able to see it does really make it difficult to communicate what it is like. And that can feel really lonely and isolating. It gives the impression that it's not valid, that
Right.
it's real. It certainly ties into the stigma of seeking out mental health services for physical,
Mhm.
which is something that I'm really passionate about, is advocating for that, because it's not something people think of necessarily. Oh, my body hurts, I should go to a pain management provider, an orthopedic surgeon, a chiropractor, someone who is going to take an x-ray of my body, find out what's wrong, and prescribe a medication or maybe physical therapy or an injection or something like that. But the misconception that utilizing mental health services for chronic pain management, that it's all in your head.
Right. Yes. And if you don't have that reminder for friends or coworkers or bosses either that, oh my gosh, she's calling out sick again, forgetting that she has this really major significant thing going on in her life and she's not just like wanting a day off.
Exactly.
Yeah, and I know for myself, way back in the early days of my private practice work, I had a client come in who the presenting problem was chronic pain. And I remember feeling this panic that on the periphery, I understood that mental health support was important, but knowing exactly where to go with that. So I was just like, stay calm, do your intake. You have time to get some resources and support or figure out if you need to refer out, all those things. But it's not something that is top of mind for most of us. And it's certainly not a topic that we get trained on in graduate school.
Absolutely not. And I have personal experience with chronic pain, and it was not even a thought in my mind that I should seek out therapeutic resources or read up on books by mental health practitioners about the experiences that I was going through and how I could manage it in ways other than just leaning into the medical system. And this is what I do. I just not at all what you think about, but there's a whole field of pain psychology. It's really amazing how far it's come, even in a short period of time.
Mm-hmm. And I also would imagine for those clients out there, adding one more appointment to their list, a lot of times with chronic pain and autoimmune diseases and things along those lines, it takes forever to get diagnosed and to have someone finally validate that, okay, this is a real problem because you've seen probably countless medical providers who have dismissed you or told you to just like buck up and you'll be fine and those types of things. And so that's an important consideration.
100%. And you have to be prepared working with clients who are experiencing chronic pain for that baggage to come into the room with them and be ready to just validate that for them and process that with them before even moving into any sort of technique or treatment in terms of what you're going to do with the client, because you are very likely to 20th on their list of providers. And who knows how long this journey has been for them. It could be 1 year, it could be over a decade. That is a lot to tolerate and work to manage on your own.
Mm-hmm. So when you are first working with these clients, I would imagine you have to spend extra time building rapport because of the many experiences they probably had. So they're not coming in like ready to trust you.
Not necessarily. There's mistrust everywhere, and mistrust with the systems, mistrust with their body. So even something like a mindfulness activity, asking them to turn inward and connect with any physical sensation in their body can be extremely difficult and even triggering. And so you want to take it step by step and really just take the time to build that rapport. I think for a lot of my clients, because I'm open about being an individual who also experiences chronic pain, that's something that maybe helps form a little bit of a foundation at the start, because they can look at things that I've done or talked about in the past as being open about that and also struggling through it and figuring it out and ultimately deciding this is what I wanted to open my practice to specializing in. And so I think that helps a little, because I in some ways get it, even though I will always validate for them that even though I experience my own version of chronic pain, it will never truly feel exactly the way that they experience their pain, just like all the other people in their lives that are there to champion them and advocate for them and support them will do their best to listen and understand, but they'll never truly understand what it's like. And that can be really difficult.
Yeah, it is. And so many of us, the areas of specialty are from our on-the-job training in our own lives and understanding like the nuances and the dynamics of different things. Something you said about not trusting my body, that has been such a powerful phrase that I've heard over the years from clients. And I think we really take for granted that, oh, I know my body. As you get older, you feel like your body. And to have a place where I can't leave the house and trust that my body is going to keep itself together. I might have something with chronic GI issues, and leaving the house is terrifying. And I think it's easy to not even think about that when you have a body that mostly functions the way it should.
Take it for granted a little bit.
Absolutely, yeah.
Some people who have chronic pain, it started not with a particular injury or a traumatic incident, but they were bending over to pick up a sock and had their first muscle spasm that lasted weeks, months, could be something that like turned into a painful sensation that lasted for a year. So it could be everyday things that now they're constantly holding tension and worry and fear about doing things like sitting down or bending over or doing the laundry.
Yeah. And so along with that, I know, and I would love to hear your thoughts on this, that you need to address the grief and loss that comes with these types of things, that in addition to the chronic illness itself and the way it completely disrupts your life, but just the life that you were anticipating that now looks very different.
Absolutely. Yeah. And I think part of the chronic pain work is not only working to understand what's happening in the body, but how that then impacts everything else, which again taps into that like biopsychosocial model, how you're thinking about your pain, how you're speaking about your pain, how that's leading to changes in your eating habits, your sleeping habits, your passions, hobbies that you may have been interested in starting or will have been engaged in for a long time and are too nervous to, or feel like you've not been given permission by a provider, a medical provider, to continue doing, and how to step back and reevaluate what's really important to you, what does make you feel good, whether that's what makes your thoughts more positive, what makes your body feel better, even if it's having a warm shower and connecting physically and mentally to temperature in a way that feels really relaxing and good on your body and good for your mind, or even a cold shower, getting that 1 minute in, the cold plunges, all the rage, simple little things just to start reconnecting with things that are even just neutral, if not positive, because there's so much that can come with.
And so I'm wondering about, from my own experience years ago, I've had chronic back problems my whole life. And I was in this thing where I just hated my back and I thought about it all the time. And it was just irritated. And then I saw this thing about loving your body and having self-compassion. And so I started like waking up and going, okay, my back is there. It's strong. It's going to do its very best today. And it really did make a difference.
Yes.
So self-compassion, I imagine, is an important part of what you need to work with clients on.
100%. And so I am certified in pain reprocessing therapy and that's what I think about a lot in my work with individuals who have chronic pain. But as a therapist in general, I've come from like a very CBT background. And the things that we tell ourselves and we think up to ourselves are very impactful, and things like safety reappraisal as a technique through pain reprocessing therapy of telling yourself, I've got this, I'm safe, my muscles are strong, I've done this before, I can do it again. Being your own cheerleader as you check in with your body, to use your example, is such a critical component of reconnecting to the body in a way that feels more open and curious and less fearful and judgmental.
Mm-hmm. Okay. And so you talk about techniques to help retrain the brain. That's obviously one of them. Can you share some more?
Sure. So there's something called somatic tracking, which is very mindfulness based. And so I'll usually do some mindfulness activities that don't have anything to do with the body, because again, it can be really hard to trust the body, to move through that betrayal, to look inward without automatically becoming afraid and tensing. And then the neural pathways are just setting off this fire alarm of we're in danger, we should probably hurt. And so doing things like mindful eating with clients, taking a Hershey kiss and spending minutes with it, holding it, looking at it, examining the packaging, the little flag. What does the kiss look like when you open it up? Are there dents or divots? Does it smell really good? What does it feel like as it melts on your hand? Taking your time with it, playing games, taking a bunch of nickels or dimes and tossing them on the ground and having everybody pick up one and spending a minute looking at every aspect of the coin. Is there tarnishing? What do they notice? What's the year? And after 60 seconds, putting all the coins back in the collection, mixing them all around and seeing who can find their coin first. Like really attending to details that have nothing to do with their body, but it's getting their brain used to focusing all in on one thing, and then slowly redirecting it to maybe some more neutral experiences, like putting your hands under cold water or holding an ice cube, or just like standing out in the sun and paying attention to what that feels like on your cheek. Something in a place that isn't connected to your pain, and then moving maybe to some breathing prompts. Most people are breathing comfortably throughout the day. Obviously, if that's connected to the pain, that might be something you hold off to do until later. But having them connect to whatever part of the body feels safest, whether that's their chest, their stomach, their nose, their mouth, and just again, breathing in and out, like training the brain to attend inward, engage in a bodily process through this open and curious place. Very neutral, very safe. It's allowing you to remind your brain that you can engage in things with your body, connecting to your body in a way that feels safe. Okay. And it's paving this pathway. Not everything that happens when I look inward is negative or painful or hurtful. So it's giving you the experience of, okay, I can do things with my body that allow me to feel, even if not positive, just neutral about it. And that is really powerful, retraining your brain and those neural pathways that have been carved out by just being in chronic pain.
Yeah. And I know for the client populations that I work with, that early buy-in is really difficult with some of these techniques. It sounds so trivial to them. And especially if you've been to all these providers, and some of which maybe have had kooky, techniques they want you to try. And to get to people to buy into these things is really hard.
Yes. I think that's where some solid psychoeducation comes in, and that taps into that biology aspect of the biopsychosocial model, like understanding that there are neural pathways in the brain and that those signals like come from your body through your spinal cord to your brain. And if you are fearful of something, then like an alarm system is going to go off and your brain is going to do what it does best. It's going to protect you. So it might cause tension, it might cause pain. And so ultimately, we need to carve out new neural pathways with things as basic as running your hands underwater or taking deep breaths or standing outside together and just connecting to those physical sensations in a way of, oh, this feels really nice. I can look inward and be comfortable and open and curious and not automatically fearful. And that will then carry to some of the other neural pathways that were communicating pain before.
Okay. What are other sort of wraparound things that would be important to discuss at some point, like the cultural and societal factors? There's, depending on your culture, where you live in the world, how you are viewed with having a chronic illness can be vastly different. Is that something that you typically will bring up, or do your clients naturally bring that up at some point?
I think both. I think it's part of me understanding them as a client and what their lived experience has been like and what maybe feels like barriers they encounter on a daily basis, whether that's like on a micro level or a macro level. And then also they inevitably might say, oh, I was trying to do this at home or at work or during a family gathering, and this is something that sort of came up that made it feel difficult or was shooed off as this is silly and is this really, do you even really need this? You don't look like you're in pain. You say you're feeling better, and engaging from them also, but letting them know always that those are things that can be talked about in session and that I'm open to hearing about every aspect of what contributes to their feelings of success and their barriers to continuing to move toward progress.
Okay. I would also think that practicing some of the techniques you referred to earlier during the sessions, maybe spending a lot of time on that to really help them understand that, yes, this is working. And so that they have the willingness and confidence to try it outside of session.
Definitely. I think with any one of my clients, even those not in pain, having to model the techniques, practicing them, maybe having them explain them back to me, or I do work with a lot of adolescents and young adults. If there's caregivers or partners that are in the waiting room, bring them in and showing them what the skills are so that they can support them when they're at home. Because you also never want the client in the midst of a crisis to have to then explain what they need to those around them, best to support them as they're learning it so that the person who's with them knows how to jump in and takes that pressure off the person in pain to then explain to those around them, like, this is what I need. This is how you do it. This is how Jamiee does it. Like, do it better. That is not what they need to worry about in those moments. So any opportunity to pull in the people in their lives with their consent, of course, is gonna, I think, really be, to your point, a wraparound support when they're not with me.
Mm-hmm. Yeah. And I'm a big fan of helping them create an actual toolkit and I usually say, let's do a note on your phone because most people have their phone with them all the time. So I call it like in an emergency or SOS or help me. And then we list all of the different tools that they've learned. Because I'm like, when you're in that place where you need something right now, you can't access the logical parts of your brain to be able to go, oh, what is the thing that I did in Jamie's office that was so helpful?
100%. I do something called calming kit with all of my clients. It started with like younger clients, but honestly, my adults love it just as much. And it's to that point of when you're overwhelmed by something, you're not going to go into your like cognitive space and pull out the list of coping skills, choose one that you think is going to be most effective and likely implement it effectively. That's going to be so hard. So I create with them a coping kit that it just taps into each of the five senses. And I have a bucket of things in my office. We go through what they might tap into naturally in their everyday life. Do they reach for something that they can listen to? Are they a person that has like specific outfits they like to wear when they're hurting, certain like tastes or smells? And so we create a little basket of little items that they can access at like most dollar stores. Low expectations if they want to build upon their coping kit. Things that can also like fit in the palm of their hand if they need to bring it to school or to work or like in the car or sit with it at a gathering that is very stressful, at a doctor's office, and that they can literally reach for when they're feeling overwhelmed, so as not to have to go into their mind and think about these things. That's going to be so hard to like claw through the cloudiness of that all and literally just keep the basket or aspects of that basket in different areas where they tend to anticipate stress or pain, like on the couch where they sit where they're not feeling good, on their nightstand, like at the table, in the car, so they can literally just reach for an item and utilize it. That can be so helpful.
Yeah, I can imagine. That sounds wonderful. I think everyone could use that actually.
100%. That's what I generalize it to all of my clients. Sometimes my parents of my younger clients like will see it and be like, "Oh, you're so lucky. That's like a cute thing. Kids probably love that." And then the next hour, my 33-year-old client comes in and is, "Can I look at the coping kit like container? I think I'm running out of things and I need some more." So it's for everyone. Everyone loves that.
Yes. Absolutely. Yeah. And I was just thinking about a dear friend that I was talking to yesterday who's had lots of complications following a surgery. And she was saying, like, everyone is just really tired of all my needs. And I was like, and we were in the field together years ago. Can I ask you, I need to challenge this a little bit. Has anyone really said that? Or is that your perception that you're like wearing everyone out? And she's, oh, you're right.
Yeah. I don't we use spoon theory a lot in my
Yeah.
work. I'm familiar who you are with that, but the idea that like individuals have a finite number of spoons, which represents the sense of energy that we have every day. And I equate it sometimes with my younger clients to a tank of gas. Like, best case scenario, we wake up with a full tank of gas. And that's if we didn't have a terrible day yesterday with a lot of work or school stress. And hopefully we had a good night's sleep and nutritious meals. And you could wake up with a half tank of gas. And everything that you do, including getting out of bed, and showering and changing your clothes, is a spoon. And ultimately, you have to decide what you use your spoons for. And those spoons don't get replenished when you're hurting. And someone who's not hurting might have 50 spoons, and each thing that they do might take one spoon, but you may wake up with 6 spoons, and one thing might be 4. And so how to understand that and use that as a metaphor that you can communicate your experiences to other people, because sometimes separating the language from my pain or my disease or my diagnosis, both for the person who's trying to share that information and also for the person who's listening, the listener I might refer to them as, you don't want to be overwhelming them, and they don't want to be like, wow, this is a lot, I'm not sure what to do, and then like, how do I respond and support this person? So talking about silverware can sometimes make it much easier.
Yes. And I love spoon theory. And years ago, I started using it with my neurodivergent clients because it's that same type. It's a different type of energy that you're, navigating, but it's the same concept, and it's applicable to so many different types of things people experience in their life. But I have to say, when I first started using it, I was like, am I like stealing this from the chronic pain community in a way that's going to be harmful to them in any way?
I don't think so. I find that so much of my work and learning in the chronic pain space has been applicable to my work with my clients with depression and anxiety, which is also what I tend to specialize in, because so much of their emotional distress comes out somatically. And so many of my clients panic, and that somatic experience is something that generates a lot of fear in their mind, but also through their body, and they feel that. And so I can use a lot of the tools and techniques that I use with my chronic pain clients to work with individuals that have somatic manifestations of their other mental health needs.
Mm-hmm. Yeah. So speaking of depression, there's lots of populations where we know there's a higher risk of depression, and this is certainly an area, but trying to get them to see another person to be evaluated for meds and then maybe taking one more medication might just feel too overwhelming. How do you manage that with clients?
Yeah, I'm always open with them about my perspective on collaborating with providers and being a team who's functioning on their behalf. I want to understand what their perspective is on it. Are they a person who can't imagine taking another medication? Are they open to maybe changing some medications? Because there are meds that have been found to help with certain chronic pain conditions and also serve as a mood regulator. So maybe they're willing to swap some things out to give it a try, making sure that they trust their medication provider or find a person that they trust if they're not yet working with one. I think it's a very collaborative process, but typically something that I do end up working a lot with, because inevitably there is medication that's being prescribed to help with their chronic pain, also monitoring whether or not the side effects could be increased anxiety or increased irritability or mood dysregulation, because that could just be a side effect of the meds that they're taking to manage their physical pain, which is now causing emotional distress as well. So I think really being open with them about it, really transparent, and collaborating a lot with their providers is a great first step.
Hmm. Yeah, in my early days in the field, I worked in pediatric hospice where we had an interdisciplinary team. And I think a team approach is always a great idea, but I find these days that most medical providers are so stretched thin that can be hard to accomplish. Are you doing most of that work through the client, or are you able to connect with some of their providers?
Yes, I think asking for consent, making it, normalizing it, that I'm just one part of your team. Again, typically they're coming to me with a team already. And so saying that since they've already spent time working with this team and in an effort to minimize their felt pressure to tell their whole story all over again, I'd be happy to reach out to learn more about what's been going on from providers that they trust and feel can speak on their behalf. So I make that known pretty early on, and I'm happy to connect to them. And then, yeah, I think then it goes the other way. I'm meeting with the client maybe every week. And sometimes there's information that I think is important coming from the client that the other providers should know about. Or maybe they had a recent med management appointment and I ask, oh, did you remember to talk about this? And they're like, ooh, you know what? I don't think I did. And
Yeah.
emphasizing how important it is for everyone to be aware of everything that's going on so that we can best support them, and asking if it's okay if I can reach out and update them. So
Hmm.
collaborative.
Yeah, and then a part of that team, which I think can get overlooked, is their advocacy team, like a friend that can go with them to doctor's appointments, that can maybe take some notes or listen in, or just be there to be that support that, okay, on the off chance or the depending off or likely chance that this provider is going to underestimate me or dismiss me, do I have someone that can go there with me and say, hey, wait a minute, that's not okay.
Yes, 100%. That's a huge part of the social aspect of the biopsychosocial model as I understand it, and working with their family members or just the client if the family members are not included to ask for these things and normalize how typical and helpful they can be. Like having the people in your life know when your appointments are and that you would appreciate a text before and after. Hey, I know this appointment's coming up for you. How are you feeling about it? Did you want to practice or process any things you were getting ready to say that might feel hard? Do you want me to come with you? I'm aware of the things you want to make known or ask about. And similar to reaching for a cognitive skill when you're overwhelmed, having a whole list of things that you want to talk about when a doctor potentially comes in with only 5 to 15 minutes of time set for you. Even if they're the most validating, understanding person, they might be limited by parameters totally outside of their control. And that can feel overwhelming to a chronic pain patient. So having a person in the room too to be like, oh, you know what? We actually also wanted to know about this. This was one thing that was on the list that we forgot to ask you about. Like, quickly before you go, can we address this? So having that support too to add that additional inquiry or comment that you just might be lost in the other information that you just obtained that might be surprising or negative, even positive, and you're just processing it. It's hard to just keep it to the list in a quick appointment.
Yeah, and even I've been to places where I brought a list and then I was so overwhelmed or so frustrated or had no spoons left that I wasn't looking at the list anymore. So to have someone else who was like following the list along that could say, oh, you wanted to ask about this thing would be hugely helpful.
Absolutely. And then having someone who's there at home to check in on you, even beyond a text, but the text is sometimes all that you need and extremely appreciative. Just knowing that someone's thinking about you and with you on this journey, even if they're not able to be physically with you. But having someone, again, who's been in sessions, who knows the skills that you need, who knows your preferred self-soothing, having your pajamas ready, your favorite TV show playing in the background, like making the meal that's very comforting to you, like being surrounded by those supports before and after can be immensely helpful.
Yeah, I do that a lot in grief too. Let's plan ahead of time for that big anniversary that's coming up. And what are the things that we would be helpful? And let's prepare for those things. And let's bring in some supports for you. That is such a huge, important thing with most people in general, having that type of support for any difficult thing they're going through in their life.
Absolutely.
One of my favorite things about this field is that we get to grow as people as we experience other people's experiences and their struggles, and the compassion we have for, okay, that person in the checkout line is being really rude to me, but maybe they are dealing with something I have no idea about. So I'm more patient and compassionate, I feel, after being in this field for many years. And we learn so much from them. And I would love if you could share any thoughts about what you've learned through your own journey or your clients about resilience, vulnerability, and strength, because I'm sure that a lot of times people are underestimating that in themselves. So what are the things that you've seen in yourself or your clients?
Yeah. I think even to credit people for using their spoons to get out of bed, because I find that so often that's just, of course, you're going to have to get out of bed. That's what we do. We get out of bed, but not does. Not everybody truly feels like they can every single day. And so to give them praise and props for doing those things. And I think that's a reminder I try and share with everyone, no matter what their presenting concerns are, no matter what their age is, to identify the small wins and remind yourself of them throughout the day, because we can't always depend on other people's compassion and empathy. But if we feel that internal locus of control and we're feeling positive about that, that can be amazing. And the more you work with people on identifying that in themselves, I have to model that for them. So I internalize that as well. And so giving myself props for doing things sometimes when I have a really hard day or I'm having a flare and I'm still going about my work, I think is really great, because we do deserve the credit, all the credit for just been going. That does speak to your point, to the strength and resilience of people, and reminds them that they're taking small steps toward their progress. And even if it's scary, they're still pushing themselves and building this trust back within their body, even if it's, running their hands underwater or like taking a shower. And those might feel silly and small and things you have to do because we have to be clean. But it's
Yeah.
really big step in the direction of moving through their pain. And I think that's amazing and should be acknowledged.
Yeah, absolutely. Okay, so now let's focus a little bit on the practitioner side of this and being in private practice and the practical issues like session attendance. I know I see therapists who are like, my clients pay my full fee no matter what if they don't give me 72 hours notice, which I'm like, I can give 72 hours notice about most things in my life. And so when you choose to work with this population, are there things you have to navigate about late cancellations, attendance, and things like that, while also still being concerned about having the income that you need for your needs, personal needs and business needs?
Yes, that's a great question. I think that because I'm sometimes in pain and I'm working with clients in pain, my office is set up in a way that's conducive to someone being uncomfortable and still being able to be in the session. So we have foam rollers, we have heating pads, we have like jade rollers that are in the refrigerator, all sorts of things that they can use. They can be on the couch, they can be in a blanket, they take their shoes off, they could be rolling around on the floor, they could be on the wall with a ball. It's flexible. They don't have to keep themselves together and get dressed. They could be in their pajamas and sit with me in whatever way feels comfortable to tolerate. But they also know that if that feels even unimaginable, that there are lots of opportunities for us to talk on the phone, or I can send them a video link. They can be laying in their space at home in their most comfortable attire with everything that they need and still able to talk to me. And if that feels impossible, then they have the opportunity to reschedule. You have to be flexible with that. And also, I think it's helpful to allow them to practice advocating for their needs when they really don't have any spoons, because inevitably that is going to happen and they are going to feel guilty and shameful and angry with their body and maybe anxious or depressed. And so having the opportunity to work with me on, hey, Jamiee, I'm really not feeling great. I've been in a flare since yesterday. I tried all these things. Like, maybe can we try 30 minutes, or can we just see how long this goes, or I just need to reschedule. And having the practice of advocating for themselves in that way, and having me be like, no problem. Like, I hear you, I see you, you deserve to rest. Let's reschedule at a time that feels better for you. Can also be really great therapeutic practice for them to then take out into the world when they just can't do it.
Yeah. And so I think that I do and have worked with a number of people in chronic pain over the years. And I have a very flexible late cancellation, not really no-show because they're more attentive than that, but that late cancellation and having the flexibility. So especially if you're insurance based and so that video or that phone call, insurance is not going to cover that. So really thinking through, can I work with these people, or am I going to be annoyed and resentful with maybe these frequent reschedules or last minute cancellations? Because one of the things I've learned over the years is it's easy to get resentment for clients doing things that you allowed in the first place. And so it's like looking to self and thinking like, what is my capacity for this thing?
Yes, that's a great point. Absolutely. And recognizing your flexibility in being able to just pop in or send a link. I have a home office where I can function, and my office where people can come in for in-person sessions is just down the street. So it's really easy for someone to be like, listen, I'm feeling great right now. I'm fading fast. Can you pop in? And
Yeah.
with understanding that they know they can ask, and then I might be like, I'm so sorry, I cannot. This is my availability, but also I will be right there and see you in 5 minutes.
Yeah.
I think that I've decided to do. To your point, that resentment building, maybe it's worth a conversation in the future to say, I know I was able to offer this in the past. Unfortunately, with my schedule and my other work commitments, I'm just unable to take those calls or alter the timing that I come in. But always, if you're not feeling up to it, give me a call at any time and let me know, and we'll reschedule at a time that feels better for you. The client knows they can try, and then I might be available, but then I might not. And again, that's another exercise in them of being really aware of their body and their capacity and advocating for what they need with the person who is going to really work with them to figure it out.
And our field has become, and I'm not saying this is a bad thing, very specialized. People have niches and areas that they really learn and train a lot in. When I went to grad school in the 90s, and when I first started working, it was like the client comes in the room and you have to figure out how to meet their needs. And we didn't even have the internet back then. So you saw everybody. And these days there's more of this refer out. And I support that. I think that there are times that we're working with a client that's so draining for us because it's not in our wheelhouse and it's impacting our entire client load. So are there specific things that you think clinicians should really be aware of if this is not their area of specialty, but they want to work in this field and support some of these clients? Are there things that should be indicators like, okay, I need to refer this person out because I'm not going to be able to get what I need to help them the way they should be helped?
Sure. I think the more that people work in the field, the more that they're going to be able to readily identify these are populations I can really lean into. And these are populations that maybe I've tried and felt that frustration, felt that resentment, felt that pervasive flow into the rest of the caseload of, you know what, this is probably not for me. Even dynamics. I love working with teens and young adults, but sometimes the family focused work is just not for me. And I have very specific training in functional family therapy. Like, I did it for years, but it's just not what I would choose to do. I think the people that really require day-to-day family work would be best suited to see a family therapist. And that's something I'm happy to refer out to. And I always like to reframe for the clients, but also for the providers. That's not us as providers being failures or for being unable to treat someone. I'm sure with support and resources and maybe some supervision or consultation, I could easily and successfully support this family. But by referring them out to someone who specializes in that at the start, that is the most supportive thing that you can do for that family. You are being the ultimate support system by acknowledging in yourself and admitting to them, this is just not something I do or do. And so these are people that I know specialize in exactly what you're looking for. And that is you supporting them and being the best therapist. you can possibly be. But I also think ways that you can understand it in yourself are tapping into your somatic experiences. There are certain populations that give me a literal stomach ache when I'm sitting in front of them because I just feel the tension, and that's not something I'm going to be able to just sit with. Also, if you're in your head thinking about and panicking about, like, how am I going to work with this client? What are the types of things that I'm going to be able to use with them? Which modality should I even be using? Will that even be effective? And you realize you're thinking about that while the client is with you and you're not actually listening to them. You can't be with them in the moment, whether it's cognitively or somatically. It's probably an indication that they're just best served by someone else. And that will go both ways. There's going to be people who go to see someone else and are like, you know what? Let's send them to Jamiee. Jamiee loves them. And so it's like a mutual referral. So I love that. I love, again, being very collaborative with other providers. I think it's so important because we all struggle with imposter syndrome for all of our entire careers. So if you are sitting with a client who comes in who you thought, based on the 15-minute consult call or the basic demographic they filled out, that this is in your wheelhouse, and then you're realizing as it's happening in the room, oh man, then it's 100% acceptable to refer out. And I even integrate that into my spiel when I'm first meeting with a client and their family, that at the end of the first session, I'm going to touch base with the client to see how they feel and normalize that I might not be the best fit for everyone. And that if they feel that way, I'm not going to be offended. If they don't make another appointment with me, I'm happy to make a referral to someone else once I have a better understanding of what's going on and what they're looking for. And same thing for providers. Like, you get to say at the end of the session, listen, I really appreciate you taking the time to come here and meet with me. Based on what you're telling me is going on and what you need, I actually think this person would be better fit. So I can give you their information. I can see you until you connect with that person. I can be present or do a warm handoff or consult with that person, but that's just my feeling. And so it can just be part of the conversation. It doesn't have to be this stigmatized feeling of failure for us.
And I so appreciate you talking that through, the practical ways that you implement that, because that is a huge area in my consultation groups and when I'm interacting with other therapists, that we can set the tone ahead of time. We're not taught how to, at the end of the first session, tell someone they're not the right fit. And so that's really hard. I love the way you framed that. And then also when you touched on huge insecurities about referring out, and it's become such a hot button topic these days. And so people are even more insecure about referring out, and even having it clear in your head about what is my scope of practice? Who are the people I really work well with? And if I refer this person out, my colleagues aren't going to think I'm a loser and I have no idea what I'm doing. My colleagues hopefully are going to go, wow, props to her because she's in her wheelhouse and that wasn't part of it.
Yeah, absolutely. I think that will come with enthusiasm and impressiveness and, like, way to go. How do I get to that place where I can be confident in my competence and my areas of expertise and also my areas of interest, the things that I just enjoy doing? Because ultimately that is going to run its way through my entire therapy day. I'm in the office all day on Thursday, all day on Friday with clients. So it's a commitment. And if I have clients that I don't feel that I'm a good fit for, or the work feels difficult, like, that will, to your point, could throw off my whole day.
Yeah, so much so. Absolutely. All right. So I have to ask if you have a favorite catchphrase or analogy that you like to use in therapy. Can you share something with us?
Yeah, sure. In terms of working with clients with chronic pain, I always like to remind them, just because pain can be addressed psychologically does not imply that it's imaginary.
And I love that. Wow. That is such a powerful statement. Yeah. I'm just like letting that settle in for a second because that's very powerful. Yeah, that's wonderful. It's been so nice having you join me today, Jamiee. This has been a great conversation. I hope that the therapists out there listening I'm sure they're going to gain some great value for this. And I will put your contact information in the show notes in case they want to connect with you. For all of you hardworking therapists out there, please remember our work is hard, but it doesn't have to be lonely. Thank you so much for listening to the Colleague Down the Hall podcast. For show notes, links, and downloads, head over to colleaguedownthehall.com, where you'll be able to learn more about getting the clinical support you need and resources to help you work in a supported, sustainable way. If you've enjoyed this episode, please share with your therapy friends and colleagues. Subscribe to the podcast, and if you love this episode, please leave a review.